Are you currently suffering from deep buttock pain that may radiate down your leg, and that's made worse with sitting or walking? If so, these are classic symptoms of Piriformis Syndrome. Hey everyone, my name is Dr. Zach Great here, Performance Sport and Spine in Seattle, Washington. And in this video, I'm going to help you understand what this condition is, and then the most effective way to treat it without using any medications or involving injections or surgery. So this muscle is located in the back side of our buttocks, and it runs from our sacrum to our thigh. So think of like my two fingers here is that muscle. Think of this red band as your sciatic nerve that runs down the back of your leg. And my fingers are the piriformis. Now there's different variations. Sometimes it can be on top, sometimes it can be behind, or it can split. Again, there's 6 different normal variations. And with this muscle being in your buttocks, the main function of it is to actually rotate that hip or turn your toes outwards. This is most commonly caused by either overuse or direct trauma, such as a fall to your buttocks region. And the 4 main cardinal symptoms of this are deep buttock pain that may also have some radiation down the leg or some tingling feeling, palpation of that piriformis should reproduce it, it's often worse with sitting, and then different orthopedic tests should reproduce your buttock and or leg pain. Now you know what it feels like. Well, what's causing this? And again, this is not tight muscles. This is the nerve getting compressed. So one thing, if you're suffering from this, you got to stop right away, is foam rolling or stretching, especially the ones that we show you here. When you do these, even though it may feel good in the moment, you're further compressing that nerve and prolonging your symptoms. Again, this is nerve compression and irritation, not tight muscles. With this condition, since it's due to compression, some things to think about in your day-to-day life is if you're sitting with a wallet in your rear pocket, take it out. When you do sit, try to sit on a more soft chair or use a cushion or a donut, and try not to lay on the affected side. So if your right side hurts, try to lay on your back or your left side with a pillow between your legs. And since nerve irritation is the main component here, we want to find some mobilizations and some movements that can help start calming the nerve down, and then we'll strengthen muscles secondary. So these first 4 exercises are really about trying to get that nerve to be healthier and to help to reduce your pain. Laying on your back, you're going to cross the affected leg over, so this is my painful hip, and you're just going to rotate side to side to tolerance. And again, some mild discomfort is okay, but it should not increase the pain. And with each rep, try to go a little farther than the previous rep. For the rock back, again, if this is the painful hip, we're going to cross our leg in and then sit down into that motion. But again, you don't want to go all the way because you'll compress it, so you want to just sit a little bit and then come up. And again, your symptoms should get better as you do it, never worse. For the supine or laying on your back version, again, if this is the affected leg, we're going to hold our leg with our hands and then straighten our knee to tolerance and then come back. Again, this is a movement, not a stretch, so we never want to hold hard, but you're just going as far as you feel comfortable, and then return to the starting position and try to go a little farther on the next rep. One way to advance this is as you bring your knees straight, you can push your toes down, or as you bring your knees straight, you can look up. But make sure to just do one at first before you progress with both. Since walking is the second aggravating activity of this condition, we're going to cover why that is. So this is your nerve and this is the muscle. When you walk, if your pelvis tilts, it further compresses. So the picture on the right, my pelvis is neutral. The picture on the left, my pelvis is not neutral, causing more compression. And we're going to give you 4 exercises going from easier to harder to help you stabilize your pelvis when moving. If you don't have a step, a thick book or a stair will work just fine as an alternate. Level 1. So again, if this is the painful buttocks, we're going to use this hand to stabilize and this hand to make sure our pelvis stays square. And then using that muscle, we're going to raise our leg out to the side, feeling tension, and then bring back. But it's really important that you keep that pelvis square, and it's just the hip, and there's no back motion at all. So just move your hip out, pause, return to the starting position. If our right leg is a painful one, we're going to stabilize with our opposite hand and put our other hand on our pelvis. And as we step up, we're going to make sure we use those muscles to keep our pelvis level and neutral. Again, you want to feel tension here, and as you step up, pelvis is neutral. If you step up and you start to feel the pelvis kind of sink, reset, step up and drive up with the leg so your pelvis stays neutral. Level 3 is not assisted, so we're going to have our hands on our pelvis and we're going to step up with the affected leg, stand up, return to the starting position. You can do the alternate leg if you want, But it's really important that when you do the right leg, you step up, keep the pelvis neutral, and engage your hip and not your back, and your symptoms should not increase. Level 4 is going to be step up horizontally with a pause. So that same step, we're going to step up with the affected leg, pause, and then return to the starting position. Again, step up, pause, keeping that pelvis neutral, and then return to the starting position. You want to feel tension in that same gluteal area. You can do both sides, but again, spend most attention on the affected or painful side. 2 accessory exercises to strengthen the lateral hip in general is the sideline leg raise. Now we like to have it where your head, butt, and back and the back of your heel is against the wall so you can keep good form. And then using the outside of our leg, we're going to raise up and then return to the starting position. On this one, only do the painful side up. You don't want to lay in the painful side because that can compress it and further irritate it. To increase this, we're going to take our foot and internally rotate it, maintain that internal rotation. We're going to raise up, using our hip, and come down. Now this one is quite challenging, so work up to it and don't overdo it at first. If you start with 3 sets of 10 of this, you're going to pay for it. So do the other one for a little while to get a base tolerance, and then add this one. Thank you for watching our video on Piriformis Syndrome. We hope you found it educational and helpful. If you did, please like our video and don't forget to subscribe to our channel.